Urethritis is the inflammation of the urethra. The most common symptoms include painful or difficult urination and urethral discharge. It is a commonly treatable condition usually caused by infection with bacteria. This bacterial infection is often sexually transmitted, but not in every instance. It can be idiopathic, for example. Some incidents of urethritis can appear asymptomatic as well. Symptoms vary based on the cause of the diseases. For infectious causes of urethritis, symptoms may start a few weeks to several months after infection. Non-infectious causes of urethritis commonly show symptoms after a few days. Common symptoms include painful urination, continuous urge to urinate, itching and urethral discharge. Additional symptoms vary based on gender. Men may experience blood in the urine or semen, itching, tenderness, or swelling of the penis, enlarged lymph nodes in the groin area, and slash or pain with intercourse or ejaculation. Women may experience abdominal pain, pelvic pain, pain with intercourse, or vaginal discharge. Non-gonococcal urethritis typically does not have noticeable symptoms in women, however, the infection can spread to parts of the female reproductive system. Urethritis is usually diagnosed through collecting history on the individual and through a physical examination. In females, urethritis can be diagnosed with a number of tests including urine test, blood test, vaginal culture, cytoscopy, or a nucleic acid test. Women will also have abdominal and pelvic exams to check for urethral discharge, and tenderness of the lower abdomen or urethra. In men, urethritis is diagnosed by at least one of the following. Mucopurulent or purulent urethral discharge on examination, equals 2 white blood cells per oil immersion field from a gram stain of a urethral swab. Or positive leukocyte esterase N or equals 10 white blood cells per high power field of the first void urine. Men who meet the criteria for urethritis commonly get nucleic acid amplification testing for chlamydia trachomatis and Neisseria gonorrhoeae to determine the type of urethritis. Men will have an exam on the abdomen, bladder area, penis, and scrotum. Additionally, a digital rectal examination of the prostate may be used if rectal pain is reported or if the individual is of older age. Primary prevention can be accomplished by the reduction of modifiable risk factors that increase the likelihood of developing urethritis. These factors include, but are not limited to, sexual intercourse, particularly unprotected intercourse, and genital irritation from contact with tight clothing, physical activity, and various irritants such as soap, lotion, and spermicides. Bacterial infections leading to gonococcal and non-gonococcal urethritis can be prevented by sexual abstinence, use of barrier contraception, such as condoms, pre-exposure vaccination, HPV and hepatitis B vaccines, reducing number of sexual partners. Chlorhexidine is an antibacterial agent that covers a wide spectrum of gram-positive and gram-negative bacteria. Rinsing with 15 ml of a 0.12% or 10 ml of 0.2% chlorhexidine solution for 30 seconds produced large and prolonged reductions in salivary bacterial counts within 7 hours of its use. One hypothesis in 2010 posed the potential use of chlorhexidine rinsing before oral sex as a prevention strategy of recurrent non-gonococcal urethritis caused by bacteria entering the urethra from oral cavity following insertive oral intercourse, particularly in men. However, actual clinical studies are yet to be carried out in order to prove this hypothesis. Antimicrobials are generally the drug of choice for gonococcal and non-gonococcal infections. The CDC in 2015 suggests using a dual therapy that consists of two antimicrobials that have different mechanisms of action would be an effective treatment strategy for urethritis, and it could also potentially slow down antibiotic resistance. A variety of drugs may be prescribed based on the cause of urethritis. Gonococcal urethritis, caused by N-gonorrhoeae. The CDC recommends administering an injection dose of ceftriaxone 250 mg intramuscularly and oral dose of azithromycin 1 gram simultaneously. Cefixime 400 mg oral single dose can be used as an alternative if ceftriaxone is not available. Non-gonococcal urethritis, caused by chlamydia trachomatis. The CDC recommends administering an oral single dose of azithromycin 1 gram or a 7-day course of doxycycline 100 mg orally twice daily. Alternative treatments can also be used when the above options are not available. Erythromycin base 500 mg orally 4 times daily for 7 days. Erythromycin ethyl succinate 800 mg orally 4 times daily for 7 days. Levofloxacin 500 mg orally once daily for 7 days. Ofloxacin 300 mg orally twice daily for 7 days. Treatment for both gonococcal and non-gonococcal urethritis is suggested to be given under direct observation in a clinic or healthcare facility in order to maximize compliance and effectiveness.